ถ้าถามว่าเรารู้ปัญหาไหมเรารู้ปัญหานะฮะแต่ว่ามันเหมือนกับมันมีสิ่งที่เรียกว่าจริยธรรมทางการแพทย์และความเสียสละค้ำคอเราคือถ้าเราไม่ออกมาตรวจแล้วคนไข้มันเขาก็รอเราแล้วจะทำยังไงอ่ะเราก็ถ้าทำได้ทนได้เราก็ทนต่อไป
Dr. Puvanai shared his personal story with Thai PBS World as the issue of overworked medical personnel has flared up on social media recently. But these problems have existed for a long time. In state hospitals, doctors and interns alike have to endure long hours, sometimes working 24 hours in a row just to make sure the patients get the medical attention they need. He explained the situation from his personal experience during his early years at a 10-bed community hospital, which served up to 200 outpatients per day. The doctor would have only few minutes to see each patient. This is on top of doing night shifts and inpatient rounds, among other things. He said he does not think working these kinds of hours is right, but it is how system has been so far, with severe understaffing issues in many hospitals. So it is not a surprise that the supply of medical personnel in Thailand is dwindling, given the harsh and unhealthy working conditions, not to mention the compensation packages for doctors at state facilities, which have been unchanged for decades.
คือว่าจบหมอเป็นอินเทิร์นมาปีแรกก็คือจะมาเจอแบบนี้คือไม่ใช่ปีแรก3 ปีจะเจอ
ใช่
แบบ
3 ปีเจอแบบ
เสร็จ
นี้
ปุ๊บไปเลือกเป็นแพทย์เฉพาะทางเรียนต่อจบมา
ก็ต้องมาเจอแบบนี้
นี้อีก
ใช่เพราะว่ามันขาดแคลนนะครับ
Dr. Puvanai said that he has put up with the working conditions this long because being a surgeon was his childhood dream, and he has a clear purpose and goal for what he wants to do. He understands, however, that a work-life balance is important, especially with the younger generation. Dr. Puvanai said there are actually two sides to the problem. The demand, which is the number of patients, and the supply, which is the number of medical staff available to treat them. We have heard many discussions and suggestions concerning the supply shortage, but the topic of demand is something rather sensitive. It is a part of the equation, but it has not been addressed. Thailand is pressed for its universal healthcare coverage, which makes healthcare more accessible for everyone, but it also brings unnecessary outpatients to the hospital. Healthcare literacy is the answer. The National Health Security Office, or NHSO, has mentioned this before. If Thailand is able to educate people so that they learn how to take care of themselves primarily and know when to seek doctor's attention, the number of people flocking into state hospitals will be much lower. This is in line with what Dr. Puvanai suggests. From data together with his experience, more than half of the outpatients waiting to see doctors in state hospitals do not necessarily need to be there. This does not include people who come into the emergency room at midnight when their condition is nowhere near an emergency. When the demand for medical staff reduces, that will also lower the pressure to produce more. As for short-term solutions, Dr. Puvanai said that high-ranking people in the medical system need to show their commitment, that they understand the problem, and that they are willing to change to build trust among next generation of medical personnel. For long-term solutions to the doctor shortage, changing mindset is the priority. People need to understand that the current system does not work and needs to be changed.
อันที่สองที่เป็นปัญหาคือ income หรือรายได้ต้องให้จะเรียกว่าต้องให้สมน้ำสมเนื้อและอาจจะไม่ถึงเอกชนนะครับแต่ต้องให้เขาพออยู่ได้
Doctors and interns haven't asked for any special treatment or privileges. They just ask for better working conditions. Everyone knows the current system does not work and has been in this state for a very long time. Until the ministry and agencies concerned make real changes, the doctor shortage is just going to get worse. No one wants to see our doctors and nurses overworked and driven out of the system. Something has to change. Tulip Nak Sompop Lao, reporting for Thai PBS World.